If you want to understand what causes a stroke, do not look at the moment it happens. Look at the 24 hours before it hits. Because here is what almost no one tells you, and what the conventional medical system has never once put in a pamphlet, a prescription pad, or a 5-minute appointment summary. A stroke does not arrive without warning. Your brain does not simply go dark without first sending a signal. The vascular system broadcasts an emergency before the crisis lands. It speaks clearly. Most people just were never taught the language. Think about that for a moment. Think about whether you have ever had a morning where your vision went slightly strange for 30 seconds and then cleared. A moment where you reached for a word and it simply was not there. And then it came back, and you told yourself you were tired. A brief episode where one hand felt different. Not numb exactly, just not quite yours. And then it passed, and you moved on with your day. That was not tiredness. That was not stress. That was your vascular system speaking. And what I am about to share with you is not in any pamphlet your doctor handed you. It is not on the label of any supplement you have tried, and it is almost certainly not what you think it is. Stay with me. According to the American Stroke Association, approximately 80% of all strokes are preventable. Let that land. Not 20%, not half, 80%. And yet, stroke remains the 5th leading cause of death in the United States, and the single leading cause of long-term adult disability, striking someone every 40 seconds, around the clock, without pause. More than 1/3 of stroke survivors report that they experienced clear warning symptoms in the days before their event. They felt something, they noticed something, and they did not know what they were looking at. That is not a failure of attention, that is a failure of information. The average primary care appointment in this country lasts 11 minutes. Stroke prevention, in most of those 11 minutes, means one thing: a blood pressure medication, and the instruction to come back if anything changes. What you are almost never told is what a transient ischemic attack, which simply means a brief, temporary disruption of blood flow to the brain, actually feels like from the inside. What vascular inflammation looks like the day before it becomes arterial occlusion, meaning a blockage. Why those transient symptoms matter so urgently. None of that is standard. None of that fits in 11 minutes. This information gap is not accidental. It is the product of a system built around intervention, treating the crisis after it arrives, rather than prevention, interrupting the process before it completes. And that distinction is costing people their independence, their mobility, and their lives. I have spent years practicing internal medicine and integrative cardiology, and I want to tell you something that took me too long to say loudly enough. There is a specific kind of patient I have seen more times than I can count. They come in not for their own appointment, but for the one scheduled after something already happened. They are sitting across from me, or their family is sitting across from me, and they are neurologically compromised in ways that were not there 7 days ago. And in the conversation, someone mentions it quietly. The day before, they said they felt strange. Their vision blurred for a moment. Their hand didn't cooperate when they tried to pick something up, and then it was fine. And they didn't mention it because they didn't want to make a fuss. Sitting in that room, knowing that the warning came and went unrecognized, is the reason I am here. The conversation I could not have with enough patients inside an exam room, I am having with you right now. That is the only reason this video exists. So here is exactly what we are covering: the specific physiological warning signals your body sends in the 24 hours before a stroke, and how to recognize them for what they actually are. The precise biological mechanism inside your vascular wall that generates those signals, and why it accelerates with age. Research from 3 continents that shows specific nutritional interventions can interrupt this cascade before it becomes irreversible. The exact daily protocol with specific foods, compounds, timing, and critical preparation details that I share with my highest risk patients. And the 4 most common mistakes that cause well-intentioned people to follow a vascular protection protocol and see no results whatsoever. If this is the kind of detailed, evidence-based information your doctor should be giving you but hasn't, hit subscribe before we go further. It takes 3 seconds. There is a growing community of people watching this channel who have decided to take their vascular health into their own hands. And every week, I share the information that makes that possible. Now, let me give you a picture of what is actually happening inside your arteries, because once you see it this way, you will never forget it. Think of your vascular system as a municipal water main running beneath a city that has been operating under continuous pressure for 5 or 6 decades. The pipes are cast iron. They were built well, but cast iron, under decades of pressure and chemical exposure, does not stay pristine on the inside. The interior walls accumulate buildup, not rust and mineral deposit the way a water pipe does, but a biological equivalent: inflammatory debris, cholesterol oxidation, platelet residue, layer by layer, year by year. Here is the critical thing that every infrastructure engineer knows, and most doctors never say out loud. A water main does not burst catastrophically without warning. Hairline fractures in the interior lining. Before the failure, there are pressure spikes, small seeps where water begins to push through into the surrounding material. A maintenance crew that knew what to look for could find those stress points before the rupture. They could intervene. They could reinforce the weakened section before the system failed. Your vascular wall is doing exactly the same thing in the 24 hours before a stroke. It is broadcasting stress, brief vision disturbances, a moment of word-finding difficulty that clears within minutes, sudden, unusual fatigue that feels different from ordinary tiredness, a fleeting weakness on one side of the body, a blood pressure reading that spikes sharply and then normalizes within hours. These are not random. They are the hairline fractures speaking. And here is the geographic reality that should stop you cold. Japanese populations, who consume diets dramatically higher in specific vascular protective compounds, carry stroke mortality rates roughly half those of comparable Western populations. Not because their pipes are newer, because their daily maintenance routine is fundamentally different. The biology is the same, the inputs are not. The center of this entire story, the biological mechanism that determines whether your vascular wall holds or fails, is a structure called the endothelium. The endothelium is a single-cell thick lining that coats the interior surface of every artery in your body. 1 cell thick. That is your primary vascular defense system, and it is extraordinary at its job when it has what it needs. Under healthy conditions, the endothelium produces a molecule called nitric oxide, which simply means a chemical signal that instructs the arterial wall to relax, stay flexible, and remain slippery, so that platelets, meaning the small clotting cells in your blood, cannot easily adhere to the surface. Nitric oxide is the reason a healthy artery feels like wet glass to a passing blood cell. Nothing sticks. Nothing accumulates. Flow is smooth and unobstructed. As we age, nitric oxide production declines. That is not in dispute. But what conventional medicine rarely emphasizes is how dramatically that decline is accelerated by 4 specific conditions: chronic low-grade inflammation, elevated blood glucose, oxidized LDL cholesterol, meaning the damaged, reactive form of the fat molecule, and sustained hypertension. These 4 conditions act on the endothelium like industrial solvent on a rubber seal. They strip its function. They make the wall rigid and adhesive, and inflammatory particles, platelet aggregates, and destabilized plaque begin to accumulate. This is what researchers call endothelial dysfunction, the precise biological condition that precedes both thrombotic stroke, meaning a clot-caused blockage, and hemorrhagic stroke, meaning a rupture. And here is the part that changes everything about how you should think about this. Without consistent intervention, endothelial dysfunction progresses silently over years, accumulating damage with no dramatic signal until a threshold is crossed and the cascade becomes acute. With targeted intervention, the same vascular wall that is currently stiffening can be meaningfully rehabilitated. Even in patients over 65, the research is unambiguous on this point. And this is the part that explains everything your doctor never had time to say. A stroke is not a sudden event. It is the final, visible moment of a years-long, progressive inflammatory process that was always interruptible. Every day is not just a day of risk, it is a day of opportunity. Now let me show you exactly what the science says about how to take that opportunity. Researchers at the Harvard T.H. Chan School of Public Health tracked over 90,000 participants across 14 years. The finding: individuals with the highest dietary nitrate intake from whole food sources carried a 42% lower risk of fatal stroke compared to those with the lowest intake. Not 5%, not 10%, 42% from food. A randomized controlled trial, meaning a rigorously designed experiment with a control group conducted at King's College London, enrolled 68 hypertensive adults, meaning adults with elevated blood pressure. Within 4 weeks of daily consumption of a specific beetroot-based nitrate compound, participants showed a reduction in systolic blood pressure, the top number in a blood pressure reading, equivalent in magnitude to the effect of a first-line antihypertensive medication. The same blood pressure reduction, no prescription, no cost, no side effects, none. Researchers at the University of California, San Diego examined endothelial function directly in 112 adults with elevated cardiovascular risk. They measured something called flow-mediated dilation, which simply means the artery's ability to expand in response to increased blood flow, a direct indicator of endothelial health. After 8 weeks of a targeted combination of flavonoid-rich foods and omega-3 fatty acids, endothelial function was significantly restored. The arterial wall was responding again. And a meta-analysis, meaning a study that pools and reanalyzes data from many independent studies, published in the European Heart Journal, reviewing 28 cohort studies across 12 countries, found that adherence to a Mediterranean-style dietary pattern was associated with a 29% reduction in stroke risk in all age groups over 60. 4 institutions, 4 methodologies, 4 countries. 1 conclusion. The vascular wall responds to what you feed it. Here is what feeding it correctly actually looks like, with the precision that makes the difference between results and none. Step 1. Every morning, within 30 minutes of waking, and before your first cup of coffee, drink 200 milliliters of fresh beetroot juice that is roughly 3/4 of a cup. Not bottled, not from concentrate, fresh pressed or cold processed. The nitrates in beetroot are converted into active nitric oxide through a specific bacterial process that begins in your mouth. This is why the preparation warning matters absolutely. Do not use mouthwash in the morning, before or after this step. Chlorhexidine, the active compound in most commercial antiseptic mouthwashes, destroys the oral bacteria responsible for this conversion entirely. And without that conversion, the nitrate you just drank produces almost no vascular benefit. This single error silently eliminates the most important step in the protocol. Step 2. With breakfast, stir exactly 3 grams of ground flaxseed, not whole flaxseed, because the intact hull blocks absorption of the active plant compounds called lignans into your oatmeal or yogurt. Add 1 tablespoon of extra virgin olive oil, either used in preparation or drizzled over vegetables. Do not heat olive oil above 375 degrees Fahrenheit. Above that temperature, the polyphenols, which simply means the protective plant compounds, oxidize and lose their anti-inflammatory function. Cold drizzle, always. Step 3. At midday, include 2 cups of raw arugula or spinach. Both carry among the highest dietary nitrate concentrations of any whole food per gram. Pair them with 30 grams of raw walnuts, not the kind roasted in commercial oils, for their ALA omega-3 content, which supports the structural integrity of the endothelial membrane itself. Step 4. In the evening, take 200 milligrams of magnesium glycinate, not magnesium oxide, which absorbs at roughly 4% efficiency and provides almost no physiological effect, despite being the most commonly sold form. Magnesium glycinate supports vascular smooth muscle relaxation and helps modulate blood pressure through the overnight hours, which is when hypertensive surges are most dangerous to an already vulnerable arterial wall. Step 5. Brew 1 cup of hibiscus tea from dried whole flowers, not a blended herbal mix, steeped for exactly 6 minutes. Multiple peer-reviewed trials have demonstrated clinically meaningful reductions in systolic blood pressure from consistent daily hibiscus consumption. 6 minutes of steeping. Not 3, not 10. 6. What you are building with this daily practice is a vascular environment where your endothelium is continuously supplied with the raw materials it needs to produce nitric oxide, resist inflammatory adhesion, and maintain the elasticity that keeps blood moving smoothly through a system that has been under pressure for decades. Now, before you go any further, there are 4 mistakes that quietly destroy this protocol for people who are otherwise doing everything right. Mistake 1. Using bottled or commercially pasteurized beetroot juice. Pasteurization uses heat that denatures the temperature-sensitive polyphenols and disrupts the nitrate-active bacterial environment. What remains is a red-colored liquid with almost none of the endothelial benefit of the fresh version. Many people follow this protocol faithfully for months, using the bottled product, and see no change in their numbers. Now you know why. Mistake 2. Using mouthwash in the morning. This bears repeating because it is the single most common silent failure in any dietary nitrate protocol. The oral microbiome, the community of bacteria living in your mouth, is not incidental to this process. It is the process. Without those bacteria performing the nitrate to nitrite conversion step, dietary nitrate cannot become active nitric oxide in the bloodstream. One rinse, gone. Every day you use mouthwash in the morning is a day the protocol does not work. Mistake 3. Taking magnesium oxide. This is one of those moments where I need you to check the bottle in your cabinet right now. Magnesium oxide is the most inexpensive and most widely sold form of magnesium supplement on the market. It absorbs at approximately 4% efficiency in the human gut. If that is what you are taking, you are spending money, feeling reassured, and receiving almost nothing. Switch to glycinate or malate. The difference in absorption is not marginal. It is the difference between an active intervention and an inert one. Mistake 4. Inconsistency. And I say this with complete compassion, because I know how life works. The endothelial benefits of a dietary nitrate protocol are measurable within 2 to 4 weeks of daily adherence. But they are also measurably lost within 72 hours of stopping. Vascular protection does not accumulate in a reserve that waits for you. It requires the same maintenance that any system running under continuous pressure requires. Think of the water main. The maintenance crew does not show up once and consider the job done. This is not discouraging news. It is the most motivating fact in this entire video, because it means that every single day you choose this protocol, it is working. Every day matters. Now I want to speak directly to something that may be sitting quietly in the back of your mind. The belief that your stroke risk is primarily determined by your genetics, your age, or your family history, and that those things are simply outside your control. That belief is understandable, and it is not accurate. Inside your body, right now, are the biological systems that make vascular protection possible. Your endothelial cells lining every artery you have are still capable of upregulating nitric oxide synthase, which simply means increasing their production of the protective signaling molecule the moment they receive adequate dietary nitrate. Your oral microbiome is intact and ready to perform the conversion the instant you stop destroying it with antiseptic rinse. The smooth muscle cells wrapping your arterial walls are still responsive to magnesium's vasodilatory signal, which simply means they can still be instructed to relax and release pressure. Your platelet regulatory system is still capable of suppressing adhesion when given adequate omega-3 substrate to work with. The biology of vascular protection is not gone at 60. It is not gone at 65. It is not gone at 70. It is present. It has simply been waiting for the right signal, the right substrate, the right daily input. The protocol you now hold is that signal. I have sat across from too many patients and their families in the week after a stroke, knowing that the warning came and went in the 24 hours before, unrecognized, unnamed, and unaddressed. You now hold the knowledge that changes that outcome. Not luck, not genetics, knowledge, and the daily choice to act on it. Someone watching this right now has a spouse, a parent, or a close friend who is already inside that pre-stroke warning window and does not know what they are feeling. Stroke strikes someone in this country every 40 seconds. The information in this video is not common knowledge. It is the conversation most doctors never have time to start. Sending this video to one person today may be the single most important health action you take this week. Please do it. And if you want to understand how the same chronic inflammatory process driving endothelial dysfunction is simultaneously accelerating cognitive decline, the mechanism that connects your gut, your brain, and your vascular wall, the next video covers the gut-brain vascular axis and the specific fermented foods shown in clinical research to suppress systemic inflammatory markers in adults over 60. That link is above. The biology connects directly. Watch it next.